Good afternoon, ladies and gentlemen, my esteemed colleagues, and the distinguished guests. I am Dr. Nishant Sharma, your moderator for the afternoon, and I'm deeply honored to welcome you to this special virtual session. Voice of Healthcare, in association with AstraZeneca, are proud to announce September Stand, Prostate Cancer Awareness. To start with, we first have our patient voice with us, Mr. Harlal, who's a proud survivor for prostate cancer. Good afternoon, Mr. Harlal. कैसे हैं आप?
अच्छा हूँ सर, बहुत अच्छा।
जी सर, तो आपसे कुछ कुछ बातें करेंगे। एक तो अपना नाम बताइए आप कहाँ रहते हैं?
सर नमस्कार, मेरा नाम हरलाल सिंह है। मैं राजस्थान के सीकर जिले से बिलोंग करता हूँ।
ठीक
और
है सर।
रही
हाँ
बात
जी, हाँ जी।
प्रोस्टेट कैंसर की,
जी सर, तो आपको
ये मेरे
प्रोस्टेट कैंसर डिटेक्ट हुआ था, कितना वक्त हो चुका है इस बात को?
इसी महीने जैसे 9 सितंबर 2020 में डिटेक्ट हुआ था।
ठीक है। और आप इसके बारे में थोड़ी सी आपसे बात करेंगे। तो जब आपको प्रोस्टेट कैंसर सबसे पहली बार डिटेक्ट हुआ था, तो क्या तकलीफें आने लगी थी जिसकी वजह से आप एक डॉक्टर के पास गए थे?
पेशाब में दिक्कत आ गई थी, रुक रुक के पेशाब आ रहा था। और जैसे पेशाब की हाजत ज्यादा लग रही थी, जब पेशाब करने जाता था, टॉयलेट करने जाता था, तब पेशाब वो कम, टॉयलेट कम लगता था।
हम्म। ठीक है, तो इसके बाद आपने जब एक डॉक्टर से कंसल्टेशन लिया, तो किस तरीके से आपका डायग्नोसिस हुआ? डॉक्टर ने कैसे क्या क्या टेस्ट किए? थोड़ा हमारे ऑडियंस को इस बारे में बताएं।
तो शुरुआत में मैं ये यहाँ वो जो बोलते हैं ना उसको, रास्ता साफ, जैसे प्रोस्टेट में सूजन आ गई थी। सीकर में हमारे को एक डॉक्टर थे, हरिशंकर पगड़िया, उनको दिखाया था मेरे को। तो बोला इसमें आप गदूत ग्रंथि के अंदर सूजन है। तो उन्होंने क्या किया, वो बोलते हैं उसको रास्ता साफ, मतलब वैसे जैसे लेजर से छील के वो रास्ता साफ क्लियर कर दिया, तो पेशाब सही लगने लगा। लेकिन वो छीला हुआ जो मांस के टुकड़े थे उनको जयपुर भेजा जांच में, तो उसमें एडिनोकार्सिनोमा आया। तो शाम का वक्त था, मेरे को जब पूछा मैंने डॉक्टर साहब से, हरिशंकर बगिया जी के जो मेरे कोई पहचान वाला लड़का था, उनसे वो जो जांच भेजी थी जयपुर, वाइप्सी जांच बोलते हैं आप उनको। तो बोले उस जांच का क्या हुआ? तो उसमें बोला इसमें तो आपको वो बड़ी बीमारी है। वो कौन सी बीमारी? तो बोला आपको वो एडिना कार्सिनोमा है। तो मैं एडिनोमा कार्सिनोमा क्या होता है, मेरे को तो पहचान है नहीं। बोला ये बहुत बड़ी भयंकर बीमारी। तो कैसी बीमारी? बोले इसको कैंसर बोलते हैं। तो मेरे पसीने आ गए वैसे, मतलब बहुत दिक्कत हुई। तो वो घरवाली भी वही थी, उनको भी मैं बुलाया, पास में बुलाकर बोला अकेला तो मैं लड़ नहीं सकूंगा। तो उसको बोला मेरे ये दिक्कत हो गई है, अगर तुम साथ दोगी तो मैं इस लड़ाई से जीत सकता हूँ। तो बोला उसके भी एक बार से माथा पकड़ के वो बैठ के बोले अब क्या करेंगे? मैं कुछ नहीं होगा, देखेंगे, संघर्ष करेंगे।
तो जब
तुम साथ देंगे तो
आपका ये एडिनोकार्सिनोमा डिटेक्ट हो गया था, तो उसके बाद आपकी क्या क्या ट्रीटमेंट चली? थोड़ा सा उसके बारे में बताएं हमारी ऑडियंस को।
ट्रीटमेंट में सीकर से ट्रीटमेंट नहीं लिया। डॉक्टर साहब अच्छे थे, उन्होंने बोला कि आप जयपुर पकड़ो, बड़े डॉक्टर को, अच्छे डॉक्टर को दिखाओ। तो वहां मैंने डॉक्टर साहब को दिखाया, तो उन्होंने पेट स्कैन लिखा। तो पेट स्कैन कराने के बाद में वो पेट स्कैन डॉक्टर साहब ने देख के बोला ये अब तो आपको जो प्रोस्टेट कैंसर है वो प्रोस्टेट के अंदर से बाहर हो गया, जैसे वो ग्लाइंड होते हैं, ग्लाइंडों में चला गया। तो अब आपका ऑपरेशन नहीं हो सकता, मतलब ज्यादा फैल गया है।
जी।
तो
फिर क्या आपको दूसरी ट्रीटमेंट बताई उन्होंने? अगर सर्जरी नहीं बता सके थे तो क्या बताया उसके बाद?
रेडिएशन बताया उन्होंने। एसएमएस का कोई डॉक्टर था, बुजुर्ग डॉक्टर था, बहुत अच्छा डॉक्टर था। बोला आपको ऑपरेशन कराने की जरूरत नहीं है, घबराने की कोई जरूरत नहीं है। आपको ये क्या नाम उसको, रेडिएशन। हाँ
जी जी।
आपका
तो आपके कितने
रेडिएशन हो
साइकिल और
जाएगा।
कितने महीने तक आपकी रेडिएशंस चली थी?
रेडिएशन मेरे 16 रेडिएशन चले, जो लॉकडाउन में हुआ 2020 में। लॉकडाउन में बंदी थी, फिर मैं महात्मा गांधी हॉस्पिटल में ये रेडिएशन चला मेरा।
ठीक
तो
है।
डेली
और
घर से
आपका
जाके
टोटल कितने वक्त आपकी ये 16 रेडिएशन की साइकिल्स चली, कितने कितने दिनों तक आप रेडिएशन लिया आपने?
सोमवार से शुक्रवार तक, शनिवार इतवार छुट्टी रहती थी, 5 दिन सप्ताह में 5 दिन करता था।
हम्म।
तो डॉक्टर साहब, मैं जैसे घर से ड्यूटी पर जाता हूँ वैसे घर से जाता था मैं। 7 बजे निकलता था, रोडवेज में बैठ के घर वालों को मतलब लगभग पूरों को उठा नहीं था, ध्यान में नहीं था,
जी
तो मैं बैठ के जैसे बैग डाल के चला जाता था। यहाँ सीकर रोडवेज में नौकरी करता हूँ मैं, सीकर डिपो में, राजस्थान रोडवेज में ड्राइवर की
हाँ हाँ
पोस्ट पे
हाँ।
हूँ। तो मैं
अच्छा,
घर
तो
से
अभी आपकी
ड्यूटी का नाम लेके आता
आखिरी
था।
जी अभी आपकी आखिरी रेडिएशन थेरेपी का जो डोज हुआ था उस बात को कितना वक्त हो चुका है? और अभी जैसे इस बात को लगभग 1-2 साल हो चुका है, तो रिसेंटली आप दोबारा से कौन कौन से टेस्ट कराए हैं और कैसा रिजल्ट आया उस रेडिएशन ट्रीटमेंट लेने के बाद?
हाँ हाँ हाँ, एक वो कौन सा, एक इंजेक्शन लगता है हर 3 महीने से प्रोस्टेट कैंसर का।
ठीक है।
हर 3 महीने से लेता हूँ मैं, कोई दिक्कत नहीं आती।
ठीक है। और
22.5 mg का।
आपने आखिरी बारी रेडिएशन कितने वक्त पहले लिया था? कितने साल हो गए उस चीज को?
उसका हो गए 2 साल से ऊपर ही हो गए, 2 2.25 साल हो गए।
ठीक है। चलिए, तो हमारी इस वक्त जितनी भी ऑडियंस आपको सुन रही है एज अ सर्वाइवर ऑफ प्रोस्टेट कैंसर, उसके लिए आप एक तो ये बताएं कि आप क्या मैसेज देना चाहेंगे कि अगर और कोई भी प्रोस्टेट कैंसर का मरीज इस वक्त आपको सुन रहा है जो प्रोस्टेट कैंसर से बैटल करके जीत चुके हैं, तो आप एक क्या मैसेज देना चाहेंगे सबके लिए?
मैं सबके लिए यही कह रहा हूँ कि मतलब किसी को कोई डरने की बात नहीं है, कि पहले तो इस कैंसर को समझे कि ये बीमारी है क्या। अपने शरीर की सेल्स हैं, उसका डिसऑर्डर है। ये बीमारी कोई बाहर से नहीं आती है, अपने अंदर से है, और बड़ी बीमारी है नहीं। तो
हम्म।
मन मन से निकाल देंगे कि ये, लोग तो बताते हैं कि इससे मौत, 90% लोग मौत के शिकार होते हैं, लेकिन ऐसा कुछ नहीं है।
हम्म।
सबसे
हम्म।
ज्यादा तो 50% तो इसका डर है। अगर डर
हम्म।
निकाल देते हैं तो इससे कोई भी बीमारी है उससे जीत सकते
जी
हैं।
सर।
और
तो आपको
यही
आपके
मैसेज देना
परिवार और दोस्तों की तरफ से कैसा सपोर्ट मिला आपके सारे ट्रीटमेंट के दौरान जब आपकी रेडिएशन चली? आपको आप क्या समझते हैं कि जो पारिवारिक और दोस्तों की तरफ से सपोर्ट मिलता है वो कितना जरूरी है एक एक कैंसर से बैटल करने के लिए?
देखो, वो तो वह है, जो परिवार वाले हैं वो तो थोड़ा सा डरते हैं कि ये ऐसा हो जाएगा, ऐसा हो जाएगा। लोग मिलने के लिए आते हैं, मिलने वाले आके ये बोलते हैं कि वो फलाना आदमी इतने दिन जिया था इस बीमारी से, वो इतने दिन
हम्म।
जिया था। मैं यार ऐसी बात मत करो मेरे को सामने, ऐसा कुछ नहीं है,
हम्म।
सिर्फ डर है। किसी कोई मिलने के लिए मेरे को कोई पहचान वाला बात करता था कि यार मैं मिलना चाहता हूँ, आप कहाँ हैं? तो मैं, आप
हम्म।
कब घर कब मिलोगे? बोले तो मैं खुद ही उससे मिलने के लिए चला जाता था, मेरे यार मेरे घर नहीं आना आप।
हम्म।
तो वो डरने
जी।
वाली बात मन से निकाल।
इसमें एक चीज और जो हमारी ऑडियंस आपसे जानना चाहेगी कि आपको जैसे प्रोस्टेट कैंसर 2-3 साल पहले डिटेक्ट हुआ था, अब आप फिर से हेल्दी तरीके से जी रहे हैं। आपने इस वक्त अपने रोजमर्रा की जिंदगी में क्या चेंजेस लाए हैं, क्या मॉडिफिकेशंस लाई हैं नाउ जो आपको पता है कि आपको प्रोस्टेट कैंसर रह चुका है? क्या बदलाव लाया आपने अपने अपने रोज की दिनचर्या में, अपने खाने पीने में, जो आप हमारे व्यूअर्स को बताना चाहेंगे?
मैं जैसे एक तो नमक नहीं खाता हूँ, एक चीनी,
ठीक है।
चीनी आती है ना सब, व्हाइट शुगर, व्हाइट
हम्म।
चीनी, वो नहीं
हम्म।
खाता हूँ मैं। गुड़, ये मिश्री, और देसी गाय का दूध, दही,
हम्म।
घी, सब उसी का लेता हूँ। और
जी।
जैसे मैं जैसे ही समय मिलता है या सुबह, तो गहरा सांस लेता हूँ। सुना है कि अपने शरीर के अंदर ऑक्सीजन की मात्रा बढ़ा देंगे तो वो कोई बीमारी अंदर रहेगी ही नहीं। बस यही।
ठीक है। ठीक है। ठीक है सर। इसके अलावा हम एक और चीज, आपके ट्रीटमेंट जो हुआ था उसके बारे में जानना चाहेंगे कि जब आपका ट्रीटमेंट चल रहा था, जब आपको रेडिएशन दी जा रही थी, उस दौरान कोई साइड इफेक्ट या कोई कोई आपको ऐसा बैड इफेक्ट आया था रेडिएशन से जो आप हमारे ऑडियंस को बताएंगे यहाँ?
हाँ, 16 लिखे थे, लेकिन 10 करा तब तक मैं अकेला ही हॉस्पिटल गया, रेडिएशन लिया और वापिस आ गया। लेकिन 10 के
हम्म।
बाद में मेरे जैसे वो गर्मी हो गई, और वो मस्से की बीमारी हो गई थी, मस्से जैसे वो सूजन आ गई थी। तो उन्होंने दवाई
हम्म।
दी और गाड़ी लेकर गया। लेकिन ऐसा कुछ साइड इफेक्ट नहीं हुआ ज्यादा।
ठीक है। और अभी जैसे आपको 2 साल पहले आपने आखिरी रेडिएशन का साइकिल लिया था, अभी आप कितने वक्त में डॉक्टर से दोबारा मिलते हैं? हर 3 महीने में जैसा आपने बताया?
हर 3 महीने
और
में मिलता
टेस्ट
है।
हर 3 महीने में मिलते हैं? और हर 3 महीने में हमारे ऑडियंस को ये बताइए कि कौन से टेस्ट दोबारा किया जाता है?
ब्लड की जांच की जाती है
हम्म।
और 6 महीने से प्रोस्टेट की जांच हो जाती है,
हम्म।
प्रोस्टेट की साइज
ठीक है।
जो मेरी नॉर्मल आती है हमेशा।
हम्म। ठीक है सर। हम इस सारी आपसे जो हमने कॉन्वर्सेशन करी उसके लिए आपका शुक्रिया करते हैं। एंड वी सल्यूट, हम आपको सल्यूट करते हैं कि आपने कैंसर के साथ बैटल किया एंड आप आगे बढ़कर और कैंसर पेशेंट्स और कैंसर सर्वाइवर्स को यहाँ मोटिवेट कर रहे हैं। एक आपके हिसाब से आखिरी मैसेज जो कि हमारे सारे आज जैसे प्रोस्टेट कैंसर अवेयरनेस के दिन को हम सेलिब्रेट कर रहे हैं, तो आप अपने थ्रू बीइंग अ सर्वाइवर, आप सारे जितने भी हेल्थ केयर के लोग इस वीडियो को देख रहे हैं उनको क्या बताना चाहेंगे कि प्रोस्टेट कैंसर से किस तरीके से बेहतर डायग्नोसिस किया जा सकता है, या किस तरीके से अपने आप को मेंटली प्रिपेयर करना है किसी मरीज के लिए? तो ये आपसे आखिरी कुछ 2-3 लाइंस हम जानना चाहेंगे। Yeah, I think we have just lost his connection. So stay tuned towards the second part of our discussion today, where we will have Dr. Shyam Aggarwal, who is Chairman and Director, Department of Oncology at Sir Ganga Hospital, New Delhi. And with him, we will be discussing about, we will deep dive into the conversation about what prostate cancer is, what are the different... जी
सर
सर।
सर कोई फोन आ गया था,
जी
तो मैं
जी जी।
यही सबको यही कहना चाहता हूँ कि ये प्रोस्टेट कैंसर की बात नहीं है कि अगर शरीर में कोई भी कैंसर है तो उसे डरने की कोई बात नहीं है। आदमी अगर संघर्ष करना चाहे तो कर सकता है। ये मतलब कोई बड़ी बीमारी नहीं है अगर सोचें तो। और सही समय डॉक्टर से अगर टाइम से समय पर इलाज लें तो इससे मतलब बाहर निकल सकते हैं।
जी सर।
बस यही है सर।
जी सर। नहीं सर, आपसे आपसे ये पूरी कॉन्वर्सेशन करके काफी अच्छा लगा, ये जानकर कि प्रोस्टेट कैंसर उतनी भी बड़ी दिक्कत नहीं है जितनी जितनी लोगों को अपने मन में एक विश्वास है। तो काफी अच्छा लगा।
सर सर
आप
सर
अपनी
एक बात और
सेवा
कहना चाहता हूँ।
प्लीज।
सर
प्लीज।
सर जैसे कैंसर पेशेंट है तो वो क्या किसी माहौल में या विवाह में या किसी पार्टी में नहीं जाता है, वो गलत है। सब जगह जाना चाहिए उसको। ये नहीं होना चाहिए, बोल देना चाहिए मतलब कि मेरी ये दिक्कत है, भगवान ने कर दिया लेकिन मैं संघर्ष करूंगा इससे। कोई बड़ी बीमारी नहीं है। थैंक यू सर।
चलिए, थैंक यू मिस्टर हराल, आपसे बात कर कर काफी अच्छा लगा। एंड अपना ध्यान रखिए। आपसे
ठीक है
कुछ
सर।
दिनों में दोबारा से बात करेंगे, दोबारा आपसे फॉलो अप लेंगे कि आप कैसा महसूस कर रहे हैं। एंड कीप मोटिवेटिंग। थैंक यू फॉर ज्वाइनिंग। थैंक यू।
ठीक है सर। ओके सर, थैंक यू।
Hi, Dr. Sham. A very good afternoon to you.
Yeah, good afternoon, Dr. Nishant. कैसे हैं आप?
बिल्कुल ठीक सर. How are you?
Yeah, I'm good.
Yes, sir. So we were just having a conversation with one prostate cancer survivor, Mr. Harlal. And to all the people who have just joined in on the video, we will now move on to the second part of today's discussion on prostate cancer awareness. And we would like to welcome Dr. Shyam Aggarwal, who is Chairman and Director, Department of Oncology at Sir Ganga Hospital, New Delhi. Very good afternoon, sir.
Yeah. Thank you. Thank you for the introduction and the invitation.
Yes, sir. Yes, sir. So I think we'll start this conversation on a few building blocks. I'd first would like for you to tell some things about what prostate cancer is, what actual functionalities does prostate deploy in the body, and then we'll start working towards the signs and symptoms towards it. Over to you, Dr. Sham.
So I think this is the Prostate Cancer Awareness Month, and the idea is to percolate information about what is prostate cancer and how it is diagnosed, and what are the symptoms, and what is the treatment. So actually, prostate is a gland which is situated, around the passage of urine called urethra, which is coming out of the urinary bladder where the urine accumulates. So basically, it has a role for the sperms and all to sort of, go into the again into the urethra, etc. So the issue comes when the person is aging. So after the age of 55, 60 years, the prostate gland actually starts becoming larger, and it becomes enlarged at sometimes, at a particular point, because, as I said, it is surrounding the passage of the urine. So that urinary passage starts getting irritated or partially blocked, and then elderly people beyond the age of 60 years can have symptoms relating to passage of urine, which can be, more frequent urination, or passage having difficulty in passing urine. I mean, you can have even dribbling of urine, etc. So urine related symptoms can happen in people who are over the age of 60 years, because of the enlargement of the prostate gland, which is very, very common. So this is the normal human body, in which the prostate gland, after a particular age of 55, 60, 65 years, it becomes enlarged and gives trouble to some people, not to everyone.
Not to everyone. So, apart from urinary symptoms, what other symptoms would one would want to take care of or should be aware of while we are talking about prostate cancer awareness?
Right. So if you look at prostate cancer as to how it spreads, so the symptoms are going to be related to that. Uh, of course, the most of the patients will have symptoms relating to urine passage, but then prostate cancer has a propensity to spread into the bones, which can be the spine, or the limbs also. It can go anywhere. So people can have bone pains, and mainly backache is a very, very common symptom of prostate cancer, number one. Number two, as it grows more and more, it also spreads into the bone marrow, underneath in the bones. And when the bone marrow gets affected, then people can have anemia, that is, the hemoglobin tends to go low, and people can feel lethargic. They can have loss of appetite, and with advanced situations, they can have loss of weight. The third issue with the prostate cancer is that it can go to the lymph nodes, particularly in the neck area. So there are people, who come to us with the nodal enlargement or a lump which is felt in the neck, and then, when we examine the patient thoroughly, then, you find that there is spread of cancer into the nodes from the prostate gland. So, these are the common symptoms. Blood in the urine is also possible if the cancer is advanced. And finally, prostate cancer is located in the vicinity of the rectum, which is the stool passage area. So I have seen patients where they complain of very severe constipation, because the prostate is so enlarged that it presses on the stool passage rectum area, and they come to us with constipation. So I mean, if somebody has persistent symptoms relating to urine, to stool, backache, lethargy, uh, and beyond the age of 60, 65 years, so one should be warned of that this could be some kind of a little sinister disease, and the investigations should begin.
Right, sir. So, building on that, what are the primary methods used for diagnosing prostate cancer? Let's educate our audience on that.
Right. So, if there is a suspicion of prostate cancer, so a couple of tests which are really critical and can lead us to the diagnosis is the use of a very, very simple blood test, which is called prostate specific antigen, or a PSA test. So, normal range is up to 4 nanograms per milliliter. So, if somebody has the figures beyond the normal limit, and especially beyond 10, 15, or 20, then the
Mm-hmm.
suspicion of prostate cancer becomes high. It is not diagnostic. Any figure is not diagnostic of prostate cancer,
Mm-hmm.
because, as I was explaining before, people at the age of 60, 65, when there is the normal enlargement of prostate, which is called the benign prostatic hyperplasia, in that condition
Mm-hmm.
also PSA can go high, 5, 6, 10, 15, and even I have seen up to 20, 30, especially if the
Okay.
patient has urinary infection. But then, if
Mm-hmm.
you treat the infection, the PSA levels come down. So you should not
Mm-hmm.
be too alarmed at the PSA figure. Single reading has very little meaning unless it is followed up. But then, if somebody's PSA is 50 or 70
Okay.
or 100, well, then there is alarm bell, that there is a strong possibility of this being prostate cancer. But then the
Right.
second thing which I was mentioning about is, you can examine the prostate of a patient by doing a simple insertion of the finger into the rectum, because you can feel the
Right.
prostate, and the normal
Right.
feel of the prostate is very soft. But in
Mm-hmm.
cancer, if somebody has prostate cancer, then it's a hard structure, which is felt, or a hard nodule, or the hard prostate can be felt depending upon how much prostate is involved. So if you
Right.
have a hard feeling in the prostate by your finger examination, well, then
Mm-hmm.
that is a very, very important sign. And then this is to be followed by a simple prostate biopsy, which is
Right.
done in the minor OT. You just insert a small needle through the rectum into the prostatic area, and you can take a small piece from there, and then that can be subjected to the pathology examination. Well, sometimes
Right.
when a patient has high PSA and urinary symptoms, and there is a suspicion of prostate cancer, people are also doing MRI of the prostate, especially multiparametric MRI has become available, and that can tell you the size of the prostate and the structure within the prostate, if there is a variation from the normal structure. So an MRI, PSA test, and finally a biopsy is done to confirm whether or not a patient has prostate cancer.
Prostate cancer or not. All right, so I think building on the same parameters and having a little more information, how do you feel early detection helps in improving the treatment outcomes?
Oh,
So I'd
absolutely.
like to hear. Yeah.
Yeah, right. So, any cancer, if diagnosed early, is curable, and same is definitely true for prostate cancer. So, I mean, if you look at the staging of prostate cancer,
Mhm.
uh, it will start from the prostate, and then it will grow outside. So, if
Right.
the tumor is confined or the cancer is confined to the prostate, it will be sort of, for lay people, stage one. So if it is going into the surrounding lymph nodes in the pelvis, then you can say it is stage 2. So if it is going, beyond the prostate or into the nodes, into the upper abdomen, then it will be stage 3. And as I
Right.
said, it can go into the bones, then it makes stage 4. So, and the PSA is a very important correlate even with the how much cancer is spread. So usually if the cancer is confined to the prostate, the PSA should be less than 20 if the prostate cancer is confirmed. And as the cancer spreads beyond the lymph nodes and all, then the PSA level will go beyond 20, 30, and 40. Bones may, when it
Mhm.
comes, so then the levels are 70 plus or
Even more.
100 plus.
Right.
So these are two correlates which we need to understand. But the point is that if the prostate cancer is confined only to prostate, when you're looking at stage 1, then the treatment is focused on controlling the cancer in the prostatic area. And there are two
Mhm.
ways of doing it. One is
Okay.
the removal of the prostate, which can be a radical prostate surgery or a radical prostatectomy. The second option is to give radical radiation to the prostate and the prostatic bed. So in America, for example, most surgeons or urologists actually are the treating people. They do surgery for early prostate cancer when the disease is confined to the prostate. And in Europe, people resort to radical radiation. So, if you look at the outcomes of this procedure in both the situations, the 10-year outcome is in the vicinity of 90 to 95%. So,
Okay.
what I mean is that 90 to 95% people will be curing their cancer if you detect cancer in first stage, that is, when it is confined to the prostate itself. So, which is
Okay.
determined by, as I said, the MRI. And now in India and all over, we have the availability of a PET scan, which is called the PSMA PET scan, or a prostate specific membrane antigen PET scan. So, which is very informative to find out whether the cancer has spread into any part of the body. So, as
Right.
you go beyond stage 1, stage 2 is again curable in 80 plus percentage. But then, in addition to the surgery or radiation, the hormonal treatment starts coming in now. So I mean,
Okay.
we, depending upon the stage of the prostate cancer, effective treatment is available to either cure the cancer or to keep it in control for a large a number of years, which can be 10, 15, 20 years plus.
Very, very rightfully said. So I think yes, early detection, hence, because the stage of the cancer is going to be lower, then the prognosis is improved as well. So
Yes.
talking on the next steps, I want you to elaborate on the various treatment options that are available for prostate cancer patients. Like you were saying, surgery or radical treatment. So let's get into depth of each. And how do you feel? Does a physician, does a clinician decide what treatment line needs to be taken, and how do patients relate to the same? So over to you, sir.
Yeah, right. So, one thing which we have to keep in mind is that the prostate cancer is a disease of elderly age group, 60, 65, 70 years. So, their comorbidities, for example, diabetes, heart condition, hypertension, or cerebrovascular accident like hemiparesis, etc. So those are contributing in terms of patient's health, and we have to take those things into sort of cognizance when we decide that a patient should be treated or not treated. Number one. Number
Right.
two, also we have to understand that prostate cancer by and large is a slow disease. So if somebody has prostate cancer, it is not that the patient is to die in 15 days or 1 month or 2 months. So it is a very, very slow disease, and there's a test which is called the Gleason score on the pathology. So 6 or 7 score is considered to be good, means that is a slow cancer. If it is 9, 10, then it is supposed to be an aggressive cancer. So these factors help us in making decisions how aggressive we should be in treating a given patient vis-a-vis the stage, vis-a-vis the comorbidities. So I mean, if you have a fit 60-year-old man who has localized prostate cancer and the PSA is less than 20, so we would like to cure him. And by, as I said before, that either you do operation or you do radiation, both the modalities will give you the same outcome. It is just a choice of the doctor and maybe the patient, and what he selects between the surgery and the radiation. So both are optimal, and one can use either of them. But let's say you have a patient who is 80 years old and he has prostate cancer which is confined to the prostate. His Gleason score is low, 6 or 7, and he has a lot of comorbidities. For example, cardiac illness, brain illness, diabetes. So there, I might just want to wait and watch. Because as I said, cancer is a slow disease. So here is a patient who's 80 years, and he can go and live with this cancer for another 10 years, as compared to a
Right.
60-year-old man where I don't want to take any chance. I like to cure. So these are factors which we help us, taking a decision. So now,
Right.
beyond the operation and the radiation, we have two modalities I just mentioned. One is the hormonal therapy, and the second is chemotherapy. So these are
Right.
usually meant for patients who have advanced disease, where possibly it has spread into the surrounding nodes or into the bones or into the vicinity of prostate.
Hmm.
So hormonal treatment, why hormonal treatment? If to understand that the prostate cancer is dependent on male hormone, which is called testosterone, which is being produced from testes of a man. So if you
Hmm.
block the testosterone, then the growth of prostate cancer is negated, and the cancer cells will die, and the patient's tumor will kind of regress, reduce in
Hmm.
size, and so will the PSA be. So therefore,
Okay.
hormonal treatment is integral part of all prostate cancer treatment today in the world for advanced prostate cancer. And the easiest what people used to do in 1950s 60s was to remove the testes of that patient who has got prostate cancer. But
Hmm.
nowadays, we are not doing that because one, it is a permanent thing, and second, we have good alternatives in the form of medications. There are
Right.
injections available called LHRH agonists or LHRH antagonists, which can be given as a subcutaneous simple injection once in 3 months or on a monthly basis, depending upon which injection you choose. So it is,
Right.
the interesting part is that these hormonal therapies have very little or no side effect. And especially, in a 75, 80-year-old person, we are giving them very, excellent quality of life. Their visits to the hospital is 4 times in a year if you have to give a 3 monthly injection,
Monthly
and
injection. Hmm.
they are extremely, extremely effective. So, hormonal therapy is effective in advanced prostate cancer in more than 80% of the patients. So,
Hmm.
I mean, we see 80, 85 years old men who have, stage 4 prostate cancer, they are virtually dying. And when you just implement this simple injection once in 3 months, 80% people will have reversal of cancer. They will sit up, they will start walking, eating, talking, and
Hmm.
everything. Quality of life will be perfect. So now,
Right.
in addition to this injection of testosterone, ablation, we
Hmm.
have to add newer hormonal therapies which have now become available in plenty. I mean, these are new agents which are called either abiraterone or enzalutamide or apalutamide. These are the name of the drugs. So these are
Hmm.
usually combined with the injection of the LHRH agonist or antagonist, and the results go up to 90%. Finally, we do have chemotherapy, which is available for younger patients because they have side effects. And but then a combination of LHRH, abiraterone, and chemotherapy is currently used in a person who is 55, 60 years old who has
Hmm.
advanced prostate cancer to give the best out of them. Now, the final advances which are happening in the prostate cancer are basically two or three. One is the
Hmm.
understanding of the, BRCA1, BRCA2, and certain, genes which are called HRR
Hmm.
genes. So, those are supposed to be done on the prostate biopsy tissue, and if you find them to be mutated, well then there are drug lists called PARP inhibitors like olaparib, rucaparib, which can be used to control the cancer after the hormonal therapy has failed. And then we have immunotherapy also come in today for MSI high patients. But there is a new
Hmm.
advance. Again, because elderly people, we can't talk of chemotherapy too much. But then there is a radionuclide therapy. So, what it
Okay.
does is that it is a very simple injection given in the arm of the patient once in 2 to 3 months, and it goes only to the cancer areas in the body of the patient and kills the cancer
Okay.
there, whether it is the bone or the node or the prostate. So,
Prostate.
so this is called radioactive lutetium PSMA therapy. So this is again, discovered now in the last 1 to 2 years, and in
Hmm.
Delhi, several centers are doing it. So normally it is done after the failure of hormonal therapy. So you
Right.
have these kind of agents now available, whether it is
Hmm.
operation, whether it is radiation, whether it is hormonal therapy, new drugs, then
Hmm.
chemotherapy, and then the radionuclide therapy. So all these
Right.
options are exercised in a sequential fashion to control
Hmm.
the cancer for a long period of time, and patients go on to
Well
live
said.
for many years.
Hmm. Hmm. Thank you, sir, for taking us through the different treatment types that are available. Our patient was Mr. The patient that we were speaking with. He's also on a 3 month injection, so that he's well suited for hormonal therapy, and he has been off radiation for the last 2 years. He says,
Yes,
and
absolutely.
his hormonal therapy is actually then providing him a good relief.
Yes.
Moving over to the next question here, that in the context of India, how does insurance landscape affect the access to prostate cancer treatment and its management? And for any individual, any unfortunate patient who has been diagnosed with prostate cancer, what are the kind of things that they should keep in mind while seeking, let's say, coverage or insurance for the same? Over to you, sir.
Right. So, insurance coverage has over the years in India considerably improved,
Mhm.
for patients with cancer. But there are gray areas because the insurance companies tend to cover, surgery, radiation,
Yes.
chemotherapy. Sometimes there are issues on, the other issue is when it comes to hormonal therapy, these are oral tablets. And
Hmm.
the insurance companies, they, and they are the OPD based treatment. So when it is an OPD based treatment, it's very important. It's very easy for the patient because you don't have to get admitted, which is a nuisance for anybody. But then,
Right.
if you're not getting admitted, well, then the insurance companies do not, give the insurance cover a lot of times. So that becomes an issue. But then the surgery, radiation, chemotherapy, and then certain supportive therapies in the form of bone strengthening agents, etc.,
Mhm.
they are covered. But then I think if you look at my practice, if you have 100 patients of any cancer, nearly 50-60% patients have the insurance coverage. So the coverage,
Hmm.
and this figure was much lower maybe 10 years ago. Hardly 5 to
Right.
10% patients were covered. So now
Right.
with the awareness coming in, the cost of treatment going up, there is the Google and so many all the social media, etc., available. So more and more people are trying to get insured for their health problems, including cancer. And I mean, if you look at the cost of this treatment, 10-15,000 rupees a month is the cost of the new hormonal agents, and the injection is again 15 to 20,000 rupees for 3 months. So once in 3 months.
Right.
So not I mean, it is expensive, but then not expensive for everyone. I think the middle
Hmm.
class people can afford, but surely the BPL and again the lower middle class would have difficulty. But then the Indian pharma has also played a role by making available these newer drugs at a much lesser price. So I mean, at least 15-20 companies are into the fray of distributing or selling the anti-cancer drugs for prostate
Hmm.
cancer.
Thank you, sir, for sharing your insights on the same. So, as you were saying, awareness has changed in the last couple of years for cancer. And while we're talking about prostate cancer, so I obviously understand that prostate cancer awareness is very crucial. So, what strategies or initiatives do you recommend for raising awareness about prostate cancer in our community and beyond?
So I think we discussed in the beginning that the simple test called PSA test, which is the
Hmm.
blood test, not costing more than 300-400 rupees. So if the level of the PSA is high, then one starts exploring or going to a doctor. So
Hmm.
screening for the prostate cancer is the buzzword, and although there is a debate, but then since it is a very simple test, and as I said that prostate cancer is a disease of middle aged or elderly, so there are
Hmm.
guidelines that at the age of 50 or 55 plus, one can do this PSA test once in a year. And
Hmm.
people who are at high risk, for example, people who have a family history of prostate cancer, or somebody has a BRCA2 or 1 mutation, which is done for some reason of family cancer,
Hmm.
or certain ethnic Africans or black these people, so they have a higher incidence of prostate cancer at early age, then the PSA
Hmm.
testing can begin at the age of 40 or 45 years. But I think
Right.
simple to say that at the age or beyond 55, do once in a year PSA testing. And if your
Mhm.
PSA is more than 4, then go for the doctor and the digital rectal examination and suitable tests as advised by the doctor, to because all PSA highs are not prostate cancer. So I think remember
Mhm.
that, because then don't be scared, because 60, 65 you can get a figure of 6 or 7, and that is only due to the benign prostatic hypertrophy or enlargement, that is normal
Hypertension.
enlargement of prostate. So, but PSA
Right,
testing,
sir.
I think, is a good thing.
Okay, thank you for that for those words on the awareness for prostate cancer. Now, I'd like to hear your thoughts about any lifestyle changes or any preventive measures that individuals or the male population that can follow in reducing the risk for developing prostate cancer. Are there any?
Right, I mean, everybody says that prostate cancer or any cancer is a lifestyle disease. So basically,
Okay.
what it means by lifestyle disease is that if you are obese, if you are not
Mhm.
exercising, if you are not taking enough fruits, salads, and green leafy vegetables, if you are consuming a lot of fat, unsaturated fat, those pizzas and burgers and
Mhm.
bhaturas and cholas and things like that, so it's not supposed to be good. If you are
Mhm.
an alcoholic, taking a lot of alcohol, or a tobacco user or a smoker, so these are some of the predisposing factors which one should avoid. One should stay
Right.
fit, one should go for exercise, one should
Mhm.
focus on nutritious, good high protein diet, a mixture of vegetarian and non-vegetarian. So, I mean, there's nothing specific for prostate cancer to my mind, but then a healthy lifestyle is the key for keeping all cancers away from your body. However, that doesn't ensure that if you are like jogging every day and doing everything right,
Right.
one will not develop cancer. But yes, the chances of one developing cancer with a good lifestyle are much, much lower.
Right, sir. Right. So I think moving towards the end of our discussion, in your experience, what advice would you like to give to all the viewers here, or maybe the prostate cancer patients and their families viewing this? And let's also try to talk a little bit. How should they navigate through the emotional and the psychological challenges that a patient faces towards prostate cancer treatment? And your message on this prostate cancer awareness month, please, sir.
Yeah, Nishant, your voice is breaking, but then I possibly heard that
Okay.
you're
Yeah.
asking about the emotional part and the how to psychologically handle the.
Yes,
Can you hear
yes,
me?
yes.
Am
Yes,
I
I
audible?
can hear you. Yes, sir, correct. You're audible. I was asking your advice for any. You are not able to hear me, sir?
Yeah, I can't hear you, but I think what I'm wanting to say, the message would be to all that prostate cancer is a slow cancer. In an elderly or a 65, 70-year-old person, it usually is not going to kill you, because we have such extensive medication available to keep the cancer, either control, cure it, or keep it in check or in control for a large number of years, which can
Mhm.
span 5, 10, 15 years. I
Mhm.
know, I mean, a lot of patients are abandoned by their, family at this age,
Right.
from the
I think
family
we.
and
Uh-huh.
from the near and dear ones.
I think we're
Certainly,
missing out on your connection, sir. Yeah, you're back. Please continue.
yeah,
Yeah.
yeah. So yeah, so I think that's what I was saying, that I mean, you should not be scared of prostate cancer, because if it is detected in early stage, it can be eradicated, it can be cured. If it is in the advanced stage, I mean, don't lose hope, be positive. And because we have a battery of drugs which can be used one after the other to keep the cancer in control for 5 years, 10 years, 15 years, depending upon the individual to individual variation is always there. But yes, all patients or all cancer patients, including prostate cancer patients, require psychological, emotional, family support. And these are elderly individuals, 75, 80, and they tend to be neglected because, today is the era of nuclear families. So, the children are somewhere, parents are somewhere. So, only the wife is left behind. But then there is a huge scope of supporting these individuals and families by emotion, by psychologists, by the family members. So I think that should not be neglected in any way, because after all, somebody's parent or brother or husband has this disease. So I think all that emotional aspect has to go into treating a patient in a very positive fashion, because treatment alone is not enough. So the support which one gets from the family and from near and dear ones is extremely critical to tide over the crisis of cancer, whether it is prostate or otherwise.
Thank you, Dr. Sham. I think this was a very well summed up conversation about the signs and symptoms of prostate. Your emphasis on the screening for prostate for all the individuals after a certain age point, and I appreciate you spending your time on creating this impact. And I would like to thank you and thank AstraZeneca for supporting and creating this prostate cancer awareness campaign with us. So thank you and
Thank
have a
you.
good day, sir.
Thank you very much.